Okay, William. So Iowa and New Hampshire are over, and next is South Carolina. And the thing is that Romney has won both primaries, which included a pretty conservative Iowa and a pretty independent New Hampshire.
Yeah.
And now the next is the real conservative,
Right.
non-typical blue-collar Republicans in South Carolina.
I think this is where the defining moment is going to be, is if he's going to get the nomination or not. And I only say that because how he fares in the South will determine if he's going to get it, because those are the big swing states. Those are the ones that have all the delegates. Those are the ones that make a difference. Personally, I think he's a weak candidate. I think that a lot of the people are listening to the media who want Romney to be the nominee because they know that Obama can destroy him. Because basically they're kind of like the same candidate, except one's black, one's white, one worked in business, one has worked or not worked at all, except for his presidency, and being a volunteer in Acorn, which is no longer exists. That's how wonderful that place was. But that's a whole other topic. But I think that the polls, or what the media is saying, that the polls are saying that he's the most electable candidate. And you and I were even talking off camera about, well, the only thing he's basing his candidacy on, or he's trying to legitimize his candidacy, is based on the economy. You and I both know, even though the economy is turning around at a snail's pace, it's still turning. So what do you do when the economy is improving and unemployment is creeping to that 8%, closer and closer to the 7.2%? By November, it'd probably be 7.6, 7.4. I mean, you can't run against Obama about the economy anymore. What else does he have to offer? He can't repeal Obamacare, because what he did in Massachusetts was even far-reaching than even what Obama did with Obamacare. What else does he have?
Doesn't have this is the no incumbent U.S. president since Roosevelt has won on unemployment rate higher than 7.2%.
Right.
Now Roosevelt was the last one who won even the unemployment was 14 to 17%. Different books,
right,
sources.
But also he was when he took office, he was dealing with a 25% unemployment rate. So whether it's 14% or 17%, that's significant compared to what we have now, which is 10%. Going down to, hopefully, I mean not hopefully, but it probably will be hovering around 7.5%, maybe close to 8% by November. Depends on what happens in Europe. I mean, that's going to play a big part on what happens there.
Yes, we agreed upon that. That the Obama is very likely to get a credit for bringing unemployment from 11% to 7.6%, even if he doesn't hit 7.2 mark.
Right. But that'd only be because initially they were saying it only got up to 10.8, but to make it look even the spread better, they'll say 11%, maybe even closer to 12%, just for election purposes. So I mean, yeah, but they will definitely manipulate the numbers to make it look like it was all the way up here and now it's coming all the way to here, and it's almost at normal levels because of the policies and the stimulus and all the other plans that went into effect.
Well, the voters appreciated with the Roosevelt that it is going on the right direction, it is improving, and they wanted to keep the policies in the place, the process in the place. And this can end up same this year.
It could. I would agree. But here's the question: what policies have Obama adopted to improve the economy, though?
So
that's a legitimate question. What policies has he put in place to make the economy stronger and better?
This is William. This question lies in a basically very different approach to economy.
Different philosophies. I'm with you there, but that doesn't answer my question. What has he done to improve the economy of the United States?
See, if you have the simplistic Republican view that Cutting taxes,
Yeah, that's one.
cutting spending, small government deregulation. But this will solve everything.
It doesn't solve everything, but it's definitely a way to initiate and put more money. Here's the thing. In our economy, it's based on small businesses hiring, being created, and they're the ones that hire 80% of new employees, not big corporations. So that simplistic view of solving the economy, if you look at it from an entrepreneur stand, that does make sense, because if you have more money in your pocket, you're spending it, right? We have a consumer-based economy, right? It's jobs based on service, creating service jobs, fulfilling a need that needs to be met. So if I have more money in my pocket, I'm spending my money in my consumer-oriented economy, right? I'm also creating businesses that service the people who are consuming. Smaller government just means, hey, we stop sending money to Washington and allow the local government to take care of its own problems. If they aren't able to, then they go to their state level. If they can't do it at the state level, then they appeal to the federal level. But having the federal government tell you how to educate your kid through the Department of Education, that's ridiculous. That's stupid. When you at your local level have a better grasp of who's in your community, what your community needs. I'm not saying that you have to take away all of those regulations, but there are so many duplications in bureaucracy that have to do with the federal government, and then the constraints with the money that they actually hand out doesn't work. Wouldn't you agree at least with that part?
Yeah, these basic arguments are still good. I do agree. And these arguments were actually very good when we have the agrarian economy.
Right.
Now the economy, with all this industrialization and technology and global competition, now economy is much more complicated and the issues are much more complicated.
To a point.
Right. There are not just simply just cut the spending and cut the taxes. Now for a very let me give you an example. This discussion is very highly economic and very complicated, but let's just start from here. For example, this is now a very well established phenomenon that one of the major causes of losing competitiveness of U.S. businesses is the healthcare cost. Okay, now the problem is that the primary model that we adopted over the time is that businesses pay for the healthcare,
which shouldn't be,
right.
Should not have ever been.
Right. Now this just definitely increases the cost of production and makes our goods and services less competitive in the international market.
Because you're paying for healthcare.
Because the business which is producing the goods is paying healthcare and is coming out at the cost of production. Now compare it with our most important competitors right now, which are China, India, Russia, Brazil.
Yeah, but
most countries in Europe,
I would
Canada.
Agree. But before you go there, in those countries, they are so heavily regulated by the government to contain cost. Period. In China, who knows if the people have health care? Who knows? They can tell you they do, but you don't know that. In any of these countries, with the exception of the European countries. In the European countries, we know for sure they have health care provided for them by their government. In Brazil, we don't really know. We know what they show us. We know the numbers that they give us. So, yes, I would consider them competitors, but China does whatever they want. They don't even care. But at the same time, the question we have to ask ourselves is, why did corporations want to take on healthcare for us? You know why.
I think the reason I was basically laughing when I was laughing and mad at the same time when I was watching a Mitt Romney's town hall meeting in New Hampshire just the day before New Hampshire primary, and he said, first of all, he was not really able to answer any of the questions,
right. And he's not going to because he doesn't have any.
He didn't answer any of the questions, and he practically was just dodging all the questions. And so one guy, he stood up and he said, I am retired, and and my health care is just not affordable at all. It's just getting more and more expensive. And so, what you are going to do to improve the health care? And he said, you know what? Beside all that blah blah that you hear typically on these questions, he said, we are going to make it possible for you to buy your own insurance instead of getting it from your employer. And I was like, oh my gosh, what he just said, because we already have this option. Well,
Yeah.
I mean, nobody has forces us to buy insurance from employer. I mean, we just choose to get it from employer.
Well, but why do we choose that though?
That's the reason. That's because the plan that we are going to get ourselves are going to be so much more expensive than what we are getting from the employer, that we are almost everyone chooses to get it from the employer, whoever has the choice.
But you don't have a choice though.
Right.
Think about it. If you were to deregulate healthcare insurance and say that I could buy a policy as an individual from any insurer in the entire country and be covered, that changes the whole playing field. The reason why corporations wanted to be able to buy your health insurance and be in charge of that, because it was a savings for them. That's a tax write-off for them. That's less money they have to pay taxes on. It's less money they have to count as part of their profits. Also, they're able to control, so they say, cost. Okay? Why does it cost $1,000 a month for a healthy young man who's never had any health problems to buy his own policy out away from his employer? Ask yourself that. That's crazy.
That is crazy. There's a lack of
That's crazy.
competition.
And here, beyond that, why do you have to buy a healthcare insurance when if you don't even use it, you don't even get a dividend back, because the $12,000 you invested for that year, you never had to use it? Why aren't you getting money back? It's legalized racketeering. They are taking your money at $600 to $800 a month for a family. Now, granted, women and children are the number one consumers of healthcare. Most men aren't. Men go to the hospital, they're either dead, about to die, so it really doesn't matter. He's already paid in 40 years. Not one time has he gotten a dividend from all the insurance money that he's paid in. So this right here says what needs to happen in the insurance company, period. It needs to be deregulated. They need to be more accountable because they have the ability to become a mutual. That's a type of insurance where supposedly the policy owners own the insurance companies. And then there's regular insurance companies that trade on the market. Why is it you pay all this money for something, and as soon as you have a problem, you still have to end up paying more money?
You still have to. You may be just kicked out of the plan.
Yeah. Well, no, that's illegal now. They can't do that anymore. They can't drop you.
Thanks to Obama.
No, that was a good part of the plan, but that doesn't cost any money. The Obama plan itself costs trillions of dollars. That's a problem. You can deregulate insurance companies. You can put tort reform in. You can make your health insurance portable. In other words, just like your car, it's portable. You have insurance on your car, and you can buy insurance from anybody you want, and that's fine. Why isn't healthcare like that? Why does it have to be attached to your job? Because if you're an entrepreneur, you have the ability to go purchase your insurance plan without an employer, unless it's yourself. So why is it that we have to buy our insurance through our employer?
And it also I think the employer welcomed this in the beginning.
Sure, they were saving money.
Saving money, plus
they were making money too.
Plus, especially for the big corporations and businesses, it's a very strong organ to lock in the employees.
Yeah.
A lot of people who just hate their jobs and hate their employer, hate their work environment, and they just cannot quit the job or change the job just because they don't want to lose the healthcare benefits.
Right.
So it is a very, it's an anti-choice, choice thing, because it limits the people's choice to work. Basically the right to work principle, and plus now the thing is that you cannot deregulate and make them accountable at the same time. These are two opposite things.
Why not?
No, you cannot, because...
And cut.